Going for the IOZK Immunotherapy was the best thing I could have ever done. If I hadn't done that, I would have died. My name is Petra Ebel. I'm 46 years old and live in Düsseldorf. I'm now retired due to my disease, and originally I had a background in business management. In 2008, I was diagnosed with breast cancer. Of course, at the beginning, it was a huge shock to hear that I had cancer. I had no idea what I was up against. It's like your whole world collapses when you hear that. After being operated and radiated as initial treatment, and having assumed I was healed, unfortunately, 4 years later, I had a relapse. The cancer had returned. So again, I received chemotherapy and was radiated, still hoping it would go well this time. But then, another 4 years later, metastases appeared. At that moment, I was at a stage that conventional medicine considers incurable. And this was an even bigger shock than the first diagnosis, because now I realized the time I had left was limited. Now it was only a matter of extending my life as far as possible and hoping for a good quality of life. Even then, I was doing all right at first, until a very negative progression developed. In 2018, I had metastases. Cancer had spread into the liver, the lungs, the spleen, the bones, the peritoneum, so it was all over the body, and things looked really bad. My time in chemotherapy was really terrible. It's a very aggressive therapy that can be somewhat tolerated at the beginning. Losing your hair is the least of your worries. As the number of chemotherapy sessions grows, the heavy damage to the body increases. The mucous membranes get damaged, fingernails crack and break off, skin conditions develop. I had two particularly bad complications. When chemotherapy is constantly administered, the bone marrow gets strongly damaged, so it is unable to produce any more blood. I had no more defense cells. The leukocytes, or white blood cells, were all destroyed. That got me hospitalized with a neutropenic sepsis. It's a well-known fact in oncology that this can be fatal. At the end of a long period of cancer, there's a big chance of dying because chemotherapy isn't stopped in time. I then had a second heavy complication. In 2017, my liver was quite healthy. Later, metastases started in the liver. But it was actually the amount of chemotherapy that gave me liver cirrhosis. I mean, my liver was scarred and became hard. It was working worse every day. I couldn't focus because my body was being poisoned from within. And on top of that, I got abdominal dropsy. I could see my body, myself, fading away. I had tiny skinny arms, but got a really bloated and hard stomach. That's abdominal dropsy, which can develop as a side effect or due to liver cirrhosis. It's very frustrating when you realize your body is falling apart. I could sense it, and the analyses and tumor markers also showed that the chemotherapy wasn't working anymore. The body took massive damage, but the tumor marker remained. The cancer kept spreading, the dropsy increased, it got harder to breathe. It was a really desperate situation. That's when I learned about the therapy at the IOZK. I found it very interesting, and their approach made a lot of sense to me when they explained you can use your own immune system to fight the cancer, whereas chemotherapy just hits you, damaging a lot of healthy tissue, even permanently, in the long term. The therapy at the IOZK, called personalized vaccine therapy, actually puts the immune system in a condition where it can recognize cancer cells, helping the body do something itself against the cancer. My first visit to the IOZK was like a last-minute rescue. From an oncological standpoint, I had been given only a few more weeks of life expectancy. I could also feel it inside. For the first time, I truly thought it's all going to be over soon. But then we started with this new therapy. The personalized vaccine was produced twice from my own dendritic cells, which are immune cells. We also did extensive tests where we found out that besides chemotherapy, which had stopped working for me, other therapies were possible, such as one called antibody therapy that my cancer cells ought to respond to. With this new concept of antibody therapy and 2 vaccination cycles, things finally started to get better. I tolerated all these vaccines wonderfully. I didn't get any symptoms from them, and then I could feel how it started taking effect, how my body started acting against the cancer. So I took heart again that I could live for at least a little while longer and live well. Indeed, from week to week, I was doing better. My coughing was gone, and suddenly I could breathe much better. In time, maybe 4 to 6 weeks, I could sense the water in my stomach, all 4 liters, getting completely reabsorbed. I could breathe again. I could go for a normal walk. The next analysis showed that the water in my lungs and in my heart had also been reabsorbed. A very important indicator for advanced cancer is the tumor marker. When I started my therapy at the IOZK, the tumor marker was over 3,000, although it's supposed to stay under 30, so it was very far advanced. With the beginning of the new therapy, it started to go down, even in steps of hundreds, decreasing until it finally got to 70. I was used to going to the hospital and being just a number among many. I felt like nobody saw me. That is completely different at the IOZK. Each patient is given true individual care. Precise diagnostics are made for each patient to develop a completely individual therapy. This is really unusual. It's still not something you would experience in regular cancer treatment. Everyone there talks about personalized medicine, but it's not something that has reached us patients yet. But at the IOZK, it's a reality already today. Before my disease, I was a very active person. I did a lot of sports. Inline skating was my passion. We skated very long distances. I also rode around with my mountain bike. I loved to travel, but all that wasn't possible anymore when I got sick. Things got less and less until I was fully confined to bed. No sense in even thinking about it. My wonderful inline skates stood at the wardrobe, and I was about to give them away because it seemed clear I would never be able to stand on them again. With the treatment at the IOZK, when things continued to get better and improve, I could actually get back to traveling. I went on a wonderful hiking vacation to Madeira. I even climbed all the way to the top of the mountain range. So I was super proud that this was even possible. When I got back home, I was itching to give it another shot. So I got back on my inline skates. Now I can actually go 20 kilometers again.